Without further ado, Mr. Potter has more than 4 decades of experience as a communications professional, including a career as a reporter and a communication executive at the country's largest with the country's largest health insurers. Um, After seeing firsthand how strategic PR and lobbying is used unfairly to tip the scales toward corporate interest against the people's interest, Wendell left his corporate career to advocate for meaningful healthcare reform. He made headlines in '09 when he disclosed in congressional testimony how insurance companies, as part of their efforts to boost profits, have contributed to spiraling healthcare costs and the growing number of Americans without health insurance. Since then, he has spoken at more than 200 public forums and authored the award-winning New York Times bestseller Deadly Spin. He's also the author of Obamacare, uh, What's in It for Me, and what everyone needs to know about the Affordable Care Act. And he also wrote a book alongside Nick Pinneman, Nation on the Take: How Big Money Corrupts Our Democracy and What We Can Do About it. He leads two nonprofit advocacy organizations, Business Leaders for Healthcare Transformation and the Center for Health and Democracy, that convenes the Lower Out-of-Pocket Now Coalition that pushes for reforms that lower and cap out-of-pocket costs in the United States. So, Mr. Potter, thank you very much for being with us today.
My pleasure. Thank you all. Thank you, Nehemiah, and thanks everybody for showing up and being a part of this. And I do want this to be conversational. I just might add to that I worked for Cigna and Humana altogether for about 20 years. That was post my journalism career, and I've been fortunate to be able to return to journalism. As Joy referenced, we have a newsletter. It's called Healthcare Uncovered. Sign up for it if you haven't. You can find it at healthcareuncovered.substack.com. Joy, I think that's right. Maybe even find it at wendellpotter.substack.com. We've been grateful that it's grown pretty rapidly. We cover a lot that affects healthcare, public policy. We have an orientation to Washington, but also the state capitals. We most recently brought on our team Rachel Madley, who before she joined us was serving in a capacity for Congresswoman Pramila Jayapal of Washington State, who chairs the Progressive Caucus, and Rachel led the work that the Congresswoman did on most healthcare issues, including her Medicare for All bill. So our team is growing. We spend a lot of time. We publish just about something every day on our newsletter. We published a piece just this morning or this afternoon on the FTC report that was published today. It's actually an interim report by the FTC, which 2 years ago launched an investigation into the big pharmacy benefit managers that are owned by big insurance companies. And I work for one of them. Cigna owns one of the largest PBMs when it acquired Express Scripts a few years ago. The others are CVS's Caremark. CVS also owns Aetna, and United Health Group, which is the biggest in the group, which has a division called Optum that encompasses their PBM called Optum RX. Some of the reasons that I left the industry in the first place, by the way, I'd left the industry in 2008 after what I've often referred to as a crisis of conscience. I just saw too much. I will say that I have to be somewhat grateful to both Humana and Cigna for hiring me and putting me in the positions that I had, because I had great visibility into how insurance companies really operate. And I was involved in work that gave me also visibility into how these companies affect public policy, the money that they spend on lobbying and campaign contributions and the massive amounts of money they spend to influence public opinion. And I got to understand how these companies make money. My name was on all of the earnings reports that Cigna issued for 10 years. So I got to know the folks in investor relations, the chief financial officer, and that gave me a great understanding of what really motivates these companies. And what motivates them is to meet Wall Street's profit expectations. And that is as true today, if not more so than it was then. The companies have changed a great deal since I worked in the industry. Humana has morphed a number of times. When it was started, it was a nursing home company. Then it became a hospital company. And I actually joined the company when it owned hospitals. It was one of the biggest operators of hospitals in the world. I had just more recently, before that, worked for a hospital system in East Tennessee. So I come from that background in healthcare, the provider side. I didn't really appreciate the difference between a nonprofit hospital system, which is where I had worked previously in Tennessee, and for-profit healthcare, for-profit hospitals. But I learned pretty quickly, and hospital companies are no different from for-profit insurance companies, at least the for-profit hospitals, in that they answer first and foremost to Wall Street and their shareholders. So it was a great education. I again have to say that I'm grateful for that opportunity and the insight that I had. And I'm also grateful that I was a reporter in my first career. I don't think I would have become a whistleblower. I don't think I would have wanted to do what I did had I not had that crisis of conscience. Part of that was coming to the realization that what I was doing for a living was the opposite of what I had done as a reporter or tried to do, which was always to be fair and honest in my reporting, to never leave out important details, to never obscure anything that was significant or mislead people. But it became abundantly clear eventually that that's exactly what I was paid to do as an executive of these two companies, certainly in a communications capacity, of misleading the public and leaving out or obscuring important information, and working with our lobbyists in Washington to influence public policy. I became a whistleblower actually in 2009. I testified before Congress several times during the time that Congress was debating what became the Affordable Care Act. Much of what I spoke about in my congressional testimony was addressed to a certain extent in the Affordable Care Act. That bill was a massive reform bill, but it really addressed primarily just trying to improve or increase access to health care or access to health insurance. It did very little in the long run to affect prices of health care, cost of health care in this country, and hasn't done very much at all in terms of improving quality of care. And we've seen since then, since the Affordable Care Act was passed, the companies that I work for and others in the industry have become massively bigger and even more profitable. It's just a reality. I'm really grateful for what you're doing and your interest in health policy and health reform, and your advocacy for a healthcare system that would benefit everybody. By the way, our nonprofits previously had Medicare for All in their names. We have been a champion of Medicare for All. We changed the name after Bernie Sanders' campaign came to an end, and we felt we needed to broaden the scope of our work and to bring more people into advocacy. But we still are supporters of moving ultimately toward a system in which everybody is covered, a system of universal coverage. I'll stop with that, and maybe we can go through some of the other questions you all might have. And I do see them in the chat. Nehemiah, you want to look at those if you can see them, and maybe pick and choose or just go down the list, whatever you prefer.
Absolutely. We can just start with the first question. Maybe you could share a little bit more about what initially attracted you to work in the private insurance industry. And then from there, you kind of mentioned already some of the practices you saw that didn't really sit well with your conscience. So maybe you could share more about specifics of how the companies are working with lobbyists, how they're influencing public opinion, and some of the other practices you saw that kind of got you to the point where you needed to leave.
Yeah. When I was working at that nonprofit hospital system in Tennessee, it was actually the Baptist Health System of East Tennessee. It doesn't exist anymore. It long ago was subsumed into a much larger healthcare system in Knoxville. But while I was there, this was in the mid 80s, the hospital system decided it would get into the insurance business in a certain way. It was the beginning of the HMO movement. And a lot of hospitals around the country decided that they wanted to have their own HMOs. It was to their advantage to have their own insurance product, their own HMOs, to capture patients. And that was a way to funnel patients into their hospitals. And back then, the HMO model was quite different from what it is now. And largely it was based on what Kaiser Permanente has done for decades, um, an integrated healthcare system. Um, and that was my first exposure to managed care, as it came to be called. And uh, I, while I was there, I answered a call from a recruiter uh, from uh, from Louisville, Kentucky, who was representing Humana, looking for someone to come and support the hospital division of the company. By this time, Humana not only had a big hospital division that was dominant at that time, but it also had gotten into managed care and into HMOs, and in particular in Medicare. Humana was probably the first, certainly was the first big company, big insurance company or big company of any kind to get into the HMO business, and it proved to be very profitable for Humana, to the point that today and more recently, Humana not only sold its hospitals while I was there several years ago now, but it even more recently has gotten out of selling commercial insurance to individuals who are not enrolled in a public plan. The company did all that to work exclusively in the Medicare Advantage space because it has become so profitable for insurance companies. And from there, I was recruited to Cigna. And I'll be honest with you, I made those moves primarily. I was motivated by money. I was offered higher salaries, and the positions that I had, the titles I had, were of increasing responsibility. I was ambitious. I wanted to advance in my career. I By the time I left the industry, I was one of the top-ranking communications professionals in the industry, and had more or less reached the top of where I could go in the industry. But as I said earlier, that enabled me to see things that very few people who work for these companies see, and almost no one from the outside sees, and that is how these companies really do business. And there were a number of things that contributed to my decision to leave. One is I became aware I was expected to be a champion of high deductible health plans. That started during my time at Cigna. And it was an industry-wide effort to move every last one of us as quickly as possible into plans that had high deductibles or co-payments or co-insurance obligations. And I knew what was going to happen, and we're seeing that today, that more and more people with insurance can't use it because they have to pay so much out of their own pockets before their coverage will kick in. In many cases, thousands of dollars every year, and it resets every year. And most people just don't have that kind of money to pay. And people find out, frankly and sadly, when it's too late, that they're in this predicament. They need care, but they often forego care, or if they absolutely have to get it, if they have to have it, they often wind up deep in debt. And the Kaiser Family Foundation did some research a couple of years ago and reported that 100 million Americans now have medical debt, and the vast majority of those people have health insurance. But they have to pay so much out of their own pockets that they are in the ranks now of the functionally uninsured. Um, Another reason I left was because of another problem that still plagues the industry and plagues most Americans, and that is being subjected to insurance companies insisting on prior authorization or getting a treatment or a medication approved prior to a doctor doing that, treating a patient or prescribing a medication. And increasingly, patients are not getting the care that they need, or their care is delayed, if not denied. And in many cases, people are dying prematurely because of that. One of the jobs that I had at Cigna was handling what we referred to as high-profile cases, or horror stories, as we call them internally. And the media at that time called them horror stories as well, too. And we had a horror story on our hands when a patient, or when usually a reporter in the media would call asking why Cigna wasn't paying or wasn't approving coverage for a particular treatment or medication. And this was something that we handled week in and week out. We had a pretty good track record of making those stories go away, or telling reporters that we really can't even acknowledge that the person they're calling about was even enrolled in a Cigna plan because of HIPAA. That was a shield for us. But there was one case that involved a 17-year-old girl in Los Angeles who needed a liver transplant, and that transplant was scheduled, but at the very last minute, a Cigna medical director in Pittsburgh decided, in his opinion, that it was not medically necessary for Natalie Sarkeesian. That was her name. The family decided to go public with that denial. It became a very big PR nightmare for the company, to the point that the company eventually caved and decided to pay for the transplant. But as I said earlier, a lot of people faced delays, if not outright denials of care. And in Natalie's case, so much time passed, just a matter of days, about 5 days after the surgery had been scheduled but delayed. She got sicker, and she sadly died just 5 hours after Cigna reversed course and agreed to pay for the transplant. That happens every single day, countless times every day. It did that back then, and even more so today. As these companies have grown, they've made more and more aggressive use of prior authorization, and that puts them squarely between a doctor and his or her patient. And it is a contributing reason, and maybe the biggest reason, why we hear so much about physician burnout, and to the phrase that, or the term that so many doctors are using these days, moral injury, which they use to kind of characterize or describe what it's like to practice medicine when insurance companies interfere so much in the way that they are able to practice medicine. So those are some of the main reasons, and the visibility that I got, an understanding of those barriers that these companies have erected over the years. Another barrier is inadequate provider networks. The traditional Medicare program doesn't have provider networks. Almost every doctor and hospital in the country participates in the traditional Medicare program. Not so in Medicare Advantage, certainly not so in commercial insurance. So a lot of doctors, a lot of hospitals are just off limits. They are out of network. And if someone decides to go out of network, either inadvertently or knowingly, they can often face thousands of dollars in costs that they otherwise wouldn't have to face. So that's a very long-winded answer to your question, but we have gotten to the point that these companies are even more involved in patient care and interfere more and more in the delivery of care, and keep doctors from being able to treat their patients the way they know they should be treated.
Yes, it's quite disheartening hearing, you know, how invested insurance companies seems to be with, not providing, folks with the care they need in their most vulnerable times. Um, the I wanted to follow up with that, kind of hit more on how the private insurance companies are able to leverage their, you know, corporate power to influence, really our collective societal conversation on this topic. So how
Yeah.
they're able to influence politicians in terms of the political sphere, and also the public.
Two different ways primarily. One is through campaign contributions. While I was at Cigna, one of my team's responsibility was doling out campaign contributions to candidates, primarily candidates for federal office, but also for state offices, for people who were running for state legislature, for example. But much of their money goes to congressional candidates, and the money that they spend is just in the many millions of dollars to influence the outcome of elections. And they when you give a candidate a significant amount of money, it doesn't have to be actually a significant amount of money. We're talking maybe $1,000 or $5,000. These candidates become beholden to these companies. Insurance companies essentially have a lot of members of Congress in their back pocket. I'm talking about Democrats as well as Republicans. And they've long had a very close relationship with Republican lawmakers, but not exclusively. They have very close relationships with Democrats, and they also they target those campaign contributions. And I'm going to be blunt with you. They spend. I did an analysis about a year or so ago of looking at uh, where the five largest insurance companies are sending their campaign contributions, and you can go to Open Secrets and look at that. And I tallied up all the campaign contributions to those five companies, and the fifth largest recipient of campaign contributions was the Congressional Black Caucus. These companies have donate heavily to Black candidates and to the Congressional Black Caucus because they want, frankly, to protect the Medicare Advantage business. And so many of their enrollees these days are people in communities of color. They sign those people up very easily the way they are able to market those plans. So that's one way, campaign contributions. Another is lobbying. They spend enormous sums of money lobbying. My team and I wrote talking points for our lobbyists to use with lawmakers. And we had lobbyists on staff, but also many more that were on retainer who worked for lobbying companies, lobbying firms, not only in Washington, but in every state that the company does business in. And that is most states, because almost all of these big companies have members, as they call them, in every state. So they have an incentive to spend heavily on lobbying to influence the outcome of legislation in Washington or any state capital. And they're very successful. The Affordable Care Act turned out the way it did largely because of the ability of these companies to influence the legislation as it was going through the process of being written. They are always able to, in many cases, write big chunks of a piece of legislation. And if they don't like something, they can spend a lot of money to try to kill it. And they have a pretty good track record of doing that. A lot of the bills that would reform our healthcare system never make it to the finish line because these companies have so much money to kill them. So those are the two primary ways, is through lobbying and campaign contributions. Another way, though, is all the money they spend on PR and advertising and marketing. They spend huge sums of money with retaining PR firms. I managed several PR firms when I was at Cigna. Um, Huge amounts of money that we spend. We spent every month to persuade people to believe things that, frankly, were not true. And so a lot of the money that Americans pay in premiums go to propaganda campaigns, go to lobbying, go to campaign contributions. But there are very few people understand that.
Um, all very, very interesting. Um, I'm wondering in terms of the campaign contributions, how how it works exactly. Let's say a politician received the contribution, and then they had their conscience spoke to them, and they decided at that point to not do what the company basically paid them to do. What happened in that situation? Like what kind of retaliation? Um, that's what I'm wondering.
It can depend. It depends on whether or not the legislation they were interested in passed or didn't pass. Uh, but it's not just the campaign contributions to a candidate. Often, it's intimidation. Uh, they if someone refuses to vote the way that a company wants or an industry wants a member of Congress to vote, they can say, not only are we not going to give you any more money, but we can throw money at your next opponent. So that's how it works. It's intimidation. It is fear. It is the concern if you're an incumbent that the industry, if you don't toe the party line and don't toe the insurance industry's line or whatever the industry is, then the money that you had been getting in campaign contributions could go to your next opponent.
Okay, okay. So those are the ways they kind of leverage their power to get what they
Yeah.
want.
Yeah, they're very intimidating.
Actually,
Gotcha.
before you move on, Nehemiah, I actually had a question. So during your time, did you see that there was like a shift towards, more political donations or more media? And then like over time, have they started investing in like other forms of like influence as well?
Yeah, and also the campaign contributions change too. They keep track of the way the political winds are blowing. Some years you'll see that they actually give more money to Democrats and Republicans. They give money to committee chairs and congressional leaders because they have inordinate power and influence. But yeah, they spend heavily on image advertising. You see advertising on TV or and elsewhere. They want people to see them as good guys, so there's a lot of image advertising or advertising to sell their particular products. Typically, these days, they spend money advertising their Medicare Advantage plans and misleading people about that. So a lot of money goes that way. But they've changed over the years with the growth of social media. A lot of money is diverted that way to influence the way people think. And often it is in ways that people just never see. In Deadly Spin, I wrote about how this is often invisible influence. People have no idea how their thoughts and opinions are being influenced. They certainly spend a lot of money to the influential folks. Uh, and That can range from a barber to a preacher to anyone who has influence over a group of people. And they also use their nonprofit arms, their foundation. Cigna has and still has a foundation. It's called the Cigna Foundation, and they make donations to nonprofit organizations throughout the country, and it works in a very similar way to the way that they influence members of Congress and state legislators. They make donations to local nonprofits, and it's essentially buying goodwill. And If you look, there's a front group called the Partnership for America's Healthcare Future that is funded largely by insurance company money. And if you look at the list of those who are listed as members of that group, a lot of them are small chambers of commerce around the country, or nonprofit groups that presumably are involved in improving access to care for women or people of color. So they target those kinds of organizations to buy goodwill.
Okay. Thank you so much for everything you've shared with us thus far. It's a really insightful and helpful perspective. Um, you having spent so much time, in the private insurance industry, having that kind of inside look and now all the advocacy and journalism work you're doing to fight for change, what would you say is kind of some of the most the best ways for us to enact meaningful change, knowing how much money, how much power is entrenched in the current system and that we are fighting against?
It's really important to be a part of an organization or organizations that are pushing for change. I think it's important to stay informed and to be as active politically or organizationally within PNHP, for example. PNHP, I think, in recent years has become more influential than it was in its early years, and certainly during the years when I was in the industry. But be vocal. It's really important to know who represents you, who your member of Congress is, who your state legislator is. It's not enough to know their name, but you want to get to the point that they know your name. So I often tell people if they've been denied coverage for some reason, become a squeaky wheel. Doctors need to do the same thing, and all healthcare reform advocates need to be squeaky wheels. You need to be visible. You need to work individually and within an organization. And organizations certainly have the benefit of numbers. For example, in my introduction, it was noted that we lead a coalition called Lower Out of Pockets Now, and we've got more than 75 organizations that are part of that. So that makes a difference if you're trying to influence something in Washington on Capitol Hill. Having a coalition of organizations advocating for what you want to see achieved is really helpful. So there are a lot of those members are nonprofits that advocate for patients. They are patient advocacy groups or disease groups. Some are businesses. Some are organizations like Public Citizen and Families USA that focus on a broad range of issues, but have a big interest in healthcare. And some of the groups are like ACOG, the American College of Obstetricians and Gynecologists, the American Association of Emergency Physicians. They're part of the coalition as well too. So whatever you decide to do as you go into practice, you might consider becoming an active member in a professional organization like one of those, and get involved in the policy work that is important to you, and to make sure that it's important for the organization. So organizations like PNHP, but also the professional organizations are very important to be a part of too. I would encourage that.
Yes, absolutely. I hear what you're saying, that keep it, in our priorities to advocate both individually and collectively, and kind of use that collective power to enact change.